Our second speaker today will provide us the national view of housing as we age. Shannon Guzman is a senior strategic policy advisor with AARP Public Policy Institute, where she also is the deputy of the Enterprise Housing Issue Area and works on housing and livable communities policy. She provides policy analysis and guidance and develops resources to inform community members and assist local decision makers in their efforts to support residents who want to age in place. Aging in place is very important as it is a comfort level, and we've talked about housing issues and tenant and landlord situations. If we can age in place, it's great, and Shannon's going to tell us how to do it. So
yeah.
With that, Shannon, it's a pleasure to have you, and thank you for taking the time to help us with our conference.
Well, thank you, Neil, for the invitation. I'm really excited to be with the Triad Conference today and present to the attendees. I'm here to give AARP's perspective on housing and provide you initially with some trends in housing that we've seen over the past few years, and then talk to you about some of the housing challenges that people are facing, and then also solutions to help communities meet and face those challenges, including individuals. And then I'm here to answer some of your questions. So let me get started. I'm going to share my share my presentation. All right, so hopefully you can all see that. So just wanted to start off by saying I work at the Public Policy Institute, and we conduct research, we do analysis and provide policy recommendations for issues such as healthcare, Social Security, finance, housing, livable communities, and their impact on the lives of older adults and their families. So my focus is on livable communities and helping people to make more informed choices about where they want to live and how they want to live, and the housing that will best meet their needs. So I'm going to talk a little bit about some of the demographic changes we've been seeing in the US. So providing you with demographic data, it really helps illustrate how people are living and indicates what type of housing people are using and living in, and what type of housing might best fit their circumstances. So when we're developing housing policy, we need to make sure that we're taking into account the wants and needs of diverse groups and address the issues that they're facing in their homes and communities. And so this slide shows the fact that the US population is aging. And population projections show that by 2030, so in a mere 8 to 9 years, the population of people who are age 61, 65 and older will be about 21% of the population. And in fact, the census is telling us, census projections tell us that the number of older adults, again, people age 65 and older, will outnumber the number of children, the population of children age 18 and under by 2034. So there's a lot of work that needs to be done in terms of making sure we're prepared as a country to meet the needs of people as they age. So I want to talk to you a little bit about some of the households and the housing situations that people are living in. So we find that more people are living alone, or sharing their housing with other adults, much more so than the traditional nuclear family. Also, there are more younger adults living at home with a parent. About 2/3 live with a parent. And then also we're seeing an increase in the number of multi-generational households as well. There are 64 million Americans living in households with 2 or more generations. Those are generally called grand family or multi-generational households. And so their needs will be different when it comes to finding the best type of housing that will work for them. And right now, there's about 21% of these 64 million households that include someone is 65 and older. So there's definitely shifts in the racial and ethnic groups in the country as well. By 2045, the non-Hispanic white population is projected to no longer be the majority in the United States. And so there's implications there and what the communities of color will need in terms of housing. So for example, there are different populations, different groups that may choose to live together in multi-generational households. And again, thinking about the cultural needs of folks and how they choose to live will need housing that may best accommodate them as well. And then we're seeing a change in the middle class as well. The middle class has been shrinking. For that period, you see in the top right corner in that graph, the bar graph, the middle class has decreased from 61% of households to about 50% of households in 2015. So you'll see that there's a change in the number of, in the income levels. That's generally because household income has increased only slightly over the past 40 or so years. And so that has implications on what type of housing someone can afford as well. So I want to talk about some of the challenges that people are facing when it comes to housing. One is housing cost burden. And cost burden is when someone is spending 30% or more of their household income on housing. And if you're extremely or severely cost burdened, you're spending 50% or more of your household income on housing. And so between 2016 and 2017, the number of cost burden households that were headed by someone who's 65 and older grew to 10 million. And 5 million of these households were severely cost burdened, again, spending 50% or more of their household income on housing. 54% of renters 65 and older were cost burdened, and 26% of owners were also cost burdened as well. And when you're cost burdened, that means your disposable income really has to stretch. It has to include not only your housing, but transportation, your healthcare costs, your food costs, your utilities, things like that. Those all impact how much you're able to do and whether or not you're able to take care of yourself as you age. And as people get older, their income is limited. And so increases in housing can really lead people into housing instability. So what are some of the community, the challenges that communities face when it comes to what you find in the community, your health, and housing? Well, I mentioned all of the different ways the population is growing and the demographics are changing. And so largely communities aren't prepared to meet the challenges of people as they age. And this is primarily because when communities were developed, they're not necessarily thinking about those specific needs that could help support one as they age. So whether or not, like in this photo, whether or not the travel environment is safe. So there could be limited access to community amenities, such as grocery stores, or access to healthcare services, or even lack of access to places to socialize and recreate. And places to recreate can be very beneficial for your health and keeping one active and engaging in healthy behaviors. And so someone with limited mobility may not have access to certain services or certain places within the community. And that's really important to have. I was on a walking tour in my neighborhood in Washington, D.C. With a community or with a group who's interested in transportation issues. And someone was there who used a wheelchair. And we were out on a very popular area. And he was saying he would love to go out in that area, but the restaurants couldn't accommodate his wheelchair because of steps to get into. And we're talking about an older part of older infrastructure, where there are older buildings and there are more steps, but accommodations can be made to help people within the community still access those places. So it's really important to think about when we're redeveloping and updating communities, that we're thinking about what the needs of our people with various mobility levels. And then there's a lack of housing options. So, in a lot of communities, you may just see multifamily units, high rises, or you may just see single family housing, and that can be okay. That could be what the community may want or need, but you want to think in terms of what people may need long term. So they may want to move to, have options and move to different places within their community. So it's important to think about that. So there are also issues in disparities when we think about communities and their access to certain services and amenities, including houses. Where you live really matters. And so this map here is a demonstration or illustration of that. This map shows the life expectancy of people in certain areas around the Washington metro region. And as you can see, there's about a 10 to 15 year difference between people who live in some locations and other locations in the metro area. And so, we see this happen because there are gaps in health access across neighborhoods, and this could be due to residential segregation and different ways certain policies historically were applied that kept people separated by highways or other barriers that limited access and limited community cohesion and perpetuated high concentration of poverty areas. And then people had access to places where you could get healthy food, or again, engage in certain economic activities and things like that, and have access to primary care doctors or good hospitals. And so we have to think about how policy can impact all of these different areas of someone's life to impact their health outcomes. So our continued issue with the COVID-19 pandemic has also created another layer of challenges in terms of the housing space. We've seen people, it really doesn't show anything new about the housing challenges that people have been facing, but it's really making things worse or exacerbating, existing socioeconomic challenges for folks, and how well they're living. And so people have been experiencing job loss. It has a greater impact on certain vulnerable populations, such as older adults or communities of color. And although there have been short-term solutions, such as the eviction moratoria over the past year or so, and other rental assistance, people still, it doesn't cover the whole country. It doesn't cover all situations. Right now is the federal eviction moratoria sunset. You might find help, but it depends on what state you're in and what your locality is able to do for you. So people may still be experiencing or having missed mortgage payments or rental payments that will increase the threat of your becoming housing unstable. And so, we want to look at ways we maintain policies, whether or not we're in more healthy times or, during a national emergency like a pandemic, where we're making sure we can help people maintain their homes and stay in the communities that they want. So I'm going to pivot a little bit to talk more about what older adults actually tell AARP that they want in terms of their home and community. Every couple of years, AARP does a home and communities preferences survey, and this information here comes from that survey. And we continuously ask older adults how they want to live and where they want to live. Do they want to age in place? And the majority of older adults tell us that they do want to remain in their home as long as they can. And if not in their home, in their communities as long as they can. And that's generally because people have long-term stays in their homes. It's where you make really wonderful memories with your friends and family. It is places in your community are places where you volunteer, where you socialize with friends and neighbors. And so to be forced to move is very difficult. So we want to think about ways that we can help keep people in their homes effectively. And then if they have to move, then again, what are those options there within their community that can either support them in their home as they age, or that can be another housing option for them. And then want to talk a little bit about similarities across generations. Although in a lot of what AARP do, the focus is on the 50 plus, but we also are concerned with 50 plus and their families, whether or not they be much older generations, or the younger generations. We want to make sure we're creating communities really for everyone. And so one of the key pieces to this slide, which I really like, is there's a lot of sometimes framing where you have generations, pitted against one another. And I think that there are more similarities across generations than people might know about. And so when it comes to the community features and amenities that people want to have and want to see and experience in their communities, we see that there are similarities. So people want to be close to shops and services. They want a mix of housing types between generations. They'd like to see a mix of incomes, some income diversity within a community. They also want to have access to public transportation as well. So it's incumbent upon communities to think about ways that they can meet these wants and desires in a community, but also think about how they impact people at different life stages. You may be new in your career and you don't have a car yet, and so you rely on public transportation. But also, as an older adult, if you stop driving, you'd want access to public transportation as well. So transportation that is reliable and also affordable, and it takes you where you want to go. So it's just good to think about these aspects of community life and how really they contribute to your quality of life. So I want to talk a little bit about livable communities, one of the main areas that I work on. And the livable communities, the idea is that when you have certain housing, transportation, and other supportive services in place, then you're able at any life stage to be active and engaged in community life, and you can thrive across the different life stages, and that your community supports you in certain ways. So you want to see, as I've been mentioning, different housing types, a variety of housing types. You want to see that there are different destinations and amenities, so you don't have to necessarily go into another jurisdiction or across your state to find some of the services and amenities that you need, some of the healthcare services and other things that you need, that they're within a certain convenient distance for you to find. And again, that there are transportation options. And we know that people want to still use their cars. So it's about making a safe travel environment for cars, for bikes, for walking, but it's giving people, it's accommodating people to what they want, and ultimately what they're going to need. And the same for, as I mentioned, the different housing options, which I'll talk about a little bit later. Oops, let's see, where were we? And then when we talk about livable communities, they're for everyone. So it's regardless of your background, regardless of your age, whether or not you're a single person or a multi-generational family, or someone who has limited mobility or another or disability. Livable communities should be for you. So in those certain circumstances, you can go to meet your friends, you can engage in healthy behavior, get to a local park, you can go to the library. And livable communities just aren't, so this is my old neighborhood in Washington, D.C., but livable communities just aren't about places that are urban. It's about places that are suburban and rural. So, depending on what the different context is of where you live, you can provide supportive services in any of these localities or spaces. It's just making sure you understand what the needs of your various population is, of the various people in your population is, and meeting them to what is best going to fit for them. All right, so I want to talk about the crux of what I do is working on housing. As Neil mentioned, I'm a deputy on housing for this enterprise initiative that we started actually just this year. AARP is taking a much more focused approach and looking at policies and programs that are going to support people as they age in terms of housing. So really taking a look at different housing challenges across the board and trying to come up with resources that could support some communities in their plans to make housing more accessible for their community members. So we look at housing in terms of it being age friendly, and for AARP, that is supported by three main pillars, and those three main pillars are. Let's see if I put it in here. Okay, so the three main pillars are expanding housing options, and I mentioned a lot about different housing options, which I'll go over in a bit. That is making housing more accessible for folks with limited mobility, but really for everyone, because again, you may find yourself in different circumstances. And the third pillar is making things, making housing more affordable. So that means trying to find housing that accommodates accommodates people at different income levels. So to start with expanding housing options, I want to start off talking about multi-generational households. So this particular site here on this slide is Grand Families Place in Phoenix, Arizona. And it was created between a nonprofit for-profit partnership in 2020. And it has 56 units designed for grandparents who are 62 years of age and older, who are raising their grandchildren. And as I mentioned before, these multi-generational families or grand families are expanding. They've increased from 2.9 million households in 2020 to 3.2 million households in 2016. And grandparents are raising their grandchildren either because parents can't take care of their children or there's been a death. We may have seen this more as we've been, as our country's been impacted by COVID-19. But this is a place where they can be together as a family, and it is affordable, for the residents. But again, it's thinking outside of the box of what families may need and what support they may need, because their households are different than a more traditional family. And this is another type of housing option called co-housing. And in co-housing, residents get together to create an intentional community where households live in separate living spaces, but they have common shared areas like kitchen or laundry facilities. They have open space, but there's an administrative component to this as well. The households get together to maintain the property as well as share administrative duties as well. And this is Daystar, an intergenerational co-housing community in Tallahassee, Florida. And it began with 4 families and has since grown to 13 families. And their houses are clustered together. They have shared land, but their shared land and facilities that they own made the housing smaller and less expensive to build. They share the land, they share the parking, and they share common areas. And this image is a image of Cathedral Square in Vermont, and this represents housing with supportive services. As people age, the risk of disability increases, and some people may need assistance with daily tasks to help maintain their independence. And so with supportive housing, they may get certain services on site where they live, or another way to get supportive services is through what you might find in your community, even though you stay in your home. But in this case, services are provided at a site, and Cathedral Square Corporation actually has 30 different communities across the state. And a number of entities can provide supportive housing, such as healthcare agencies, faith-based organizations, and community-based volunteer groups. And in this particular case with Cathedral Square, most of those units are for lower income households. So I wanted to talk a little bit about housing affordability. And when we talk about housing affordability, it just means that housing should be available for people at different income levels. So for low-income households and for people who may find themselves in very precarious financial situations because of job loss, say what happened in this pandemic, or due to a medical emergency, their house that they're living in may not work for them anymore. And so it's making sure that you have that space, another place to go and live that is accommodating your needs. And again, we want to keep people in their homes and communities as best that we can so that there is community cohesion. And you may just want to downsize. Again, we talked about income being fixed when you're in retirement, or as you get closer to retirement and you want to increase your savings and your income is limited, that you just want to downsize. And so is there a place for you in your community that's affordable? So one of the solutions that we talk about is the missing middle housing. You may have heard, but it's housing that's largely over the course of the 20th century been zoned out of communities. So we're talking about duplexes, triplexes, townhouses, small garden style apartments, things like that, because the focus has been development on more single family detached homes and also mid-rise multifamily housing. But we should think about reintegrating these housing types back into communities because they can be more affordable than maybe some of the multifamily units, and also than the single family homes. So these housing types can fit within the existing community. They can be built on a small scale. They can be built in a way that they look like single family houses, or other types of housing. It's really thinking about, again, how we support the people in the community who may need, different housing at different price points if they want to stay long term. So we can change our zoning laws to allow for more housing types. Another solution that we often, or that we're promoting at AARP and that we're encouraging as well, are accessory dwelling units, also called ADUs, but they have various names such as in-law suites or backyard cottages or just attic apartment or garage apartment. They are separate living spaces with kitchen, bedroom, bathroom, but on an existing property. And we see ADUs really as hitting, excuse me, the three main pillars of age-friendly housing. So they provide different housing options. They're more affordable to build than single-family houses, and they can accessible housing features can be integrated into ADUs as well. And so what we've found when we ask people about ADUs from our Home and Community Preferences Survey is that currently 7% of adults have an ADU, but one in three adults would build an ADU to be closer to a loved one or to have someone close by as they age. And there are also benefits of having ADUs or allowing ADUs, excuse me for a second, of allowing ADUs in your community, in that for the homeowner, they can be a source of income generation. You could rent this out. It could also be affordable housing option for someone living in your community. One thing for older adults is that it could be a place where you may want to live as an older adult and rent out your home, and still have a separate living space, or rent out to or have a family member live there, or you could have a paid or a family caregiver live in an ADU that's close to you. So AARP is heavily involved in seeing ADUs grow and thrive across the country. We have 2 ADU publications. We have an ADU state act and local ordinance for communities they could follow and adapt. And then we also have a repository of ADU videos and stories that tell why people feel ADUs were important, and also, shows, in one case, a couple, they show the ADU that they've built that has accessible features in it. So talking about accessibility, housing accessibility, that's the third pillar of age-friendly housing that I wanted to discuss. So as you know, some homes can present physical barriers to people, especially those who have limited mobility. And so you want to make sure your house has certain features that prevent falls, and that can keep you active and engaged in community life, as some houses can limit mobility inside the home and make people have a hard time leaving their homes to socialize, or present fall risks. And so only 1% of the housing stock in the country is designed with universal design features that make homes easier to navigate. We found in our Home and Communities Preferences Survey that 30% of adults will require some kind of home modification, wider doorways, ramps, chair lifts, bathroom updates to stay in their home. And so in this particular case, this is a home with a 0-step entry and a bathroom with no threshold, and a shower with a bench in it. And I'll show a few other examples as well. So when we think about universal design in terms of housing, it means having accommodating design features, features that meet your needs, whatever your mobility level is. And it's done in a way that is appealing to everyone. So they don't look institutional, they don't look clinical, they are seamlessly integrated into the home. And so, there are certain features such as lever handles on doors and on your faucets that come down with a pull down shower head in the bathroom, a shower head that you can take down, a bench to sit in the kitchen, different counter heights, and also, spaces where you can move a wheelchair maybe underneath, or have seating where you can do prep work in your kitchen. So that's universal design, and that's what those features are. But then there's another policy approach called visitability. And this is a policy in which, if applied, new homes would have 3 specific features to make it visitable or easy to visit for someone of any level at any stage of mobility. So the 3 key features of a visitable home is a no-step entrance into the home. There are wide interior doors that accommodate a wheelchair or another walking aid. And then there's at least a half bath or a bedroom on the main floor. So it can be considered first floor living, but you have everything that you need without having to, in one place, without having to take steps. And so we've seen visitability laws in different parts of the country. And Atlanta, Georgia passed a local visitability legislation in 1992. Tucson, Arizona did in 2002, and Bolingbrook, Illinois passed a visitability law in 2004. And then this slide just showcases a house that AARP with several other partners worked on. We had a design challenge back in 2016, and we invited architects to integrate universal design and visitable features into that existing home. This was in Memphis, Tennessee. So that's the top right of your screen, and that's the home that we worked to renovate based on the winning designs from the design competition. And we created this ageless home, and that's the final product at the final version after the competition and after the renovation. So this home features 0-step entry, which they graded up with this walkway. They have wide interior doors. There's a curbless shower inside the main bathroom. And there's also flexible space in this home. So we created a wall that moves, that opens up in the space to have more space for a wheelchair or for a walking aid, or just more general space, and lessens the number of hallways that people would need to navigate. And then, but also you can close the wall and create another room for a family or a paid caregiver. So this just is kind of taking our policy off of the page and applying that in a real life situation so that people can see what actually can be done in a home. And so I'll move on to so ways that we can take certain actions in the community to make them more, to make communities more livable, and to also create better housing options for people in your community. So you want to take a holistic approach of the different aspects of community life when you're coming up with programs and other solutions, policy solutions that may affect the lives of older adults. So you want to look at the range of needs in housing, in neighborhood, in transportation, in economic and educational opportunity, or in engagement, and in community life, social or civic engagement. And you want to create a toolbox of solutions to address those various needs. You also want to engage a range of partners to help collaborate to make spaces more livable and provide more housing options. And you want people to participate in how this gets done. It can't just be the local planners or the government. They have to work in tandem with the community to make sure that they're understanding what the challenges of the community are and that they're making concerted effort to address those things. And then you want to be able to raise your knowledge about what your own needs are and what you should say what you want or advocate for in your own community. And then just understand that there are particular needs of people who are aging that you may not think about, but you need to check in and see, well, what are the services, that I may need? I'm removing this bus line, or I'm taking this type of housing out of my community. But is it working for someone who's aging? I need to consider their viewpoint and their perspective. And then you just want to create a community of partnerships across different types of groups. So intergenerational groups, industry groups, and institutions. And when it comes specifically to housing, you want to think about maybe can a community create a list of contractors for home modifications? In what ways can we change zoning to expand housing options? How do we establish a policy on visitability to make all new homes or all new homes a place where people can easily navigate? And then can we tap into things like, or create a housing trust fund? So these type of actions can help create more housing. They can make communities more accommodating for everyone in the community. So I know we have just about 10 minutes and I want to save some time for questions. So I just wanted to just share very quickly just some high points of some resources that AARP has. We have the Future of Housing website, which is www.aarp.org/future of housing, where we have the videos on ADUs that I mentioned. We have an ADU design guide and other housing resources on multi-generational housing, co-housing, manufactured housing, housing with supportive services that may be of interest to you. I mentioned our 2 publications that we have on ADUs. This is one of them. This is a step-by-step guide to design and development. What are the steps does it take to create an accessory dwelling units? And we also have a book called The ABCs of ADUs. That is a primer on ADUs. This is another section of the design guide. It has 3 different designs. It has renderings. There's even a floor plan that integrates universal design features in it for someone who has limited mobility. We also have a universal design kit, a toolkit, and this is an online toolkit based on the design challenge of the Tennessee house that I showed you, where you can get different ideas of what kind of universal design features could work in a kitchen, in, you know, common space, in your bathroom, this toolkit is tips for homeowners and for builders. And then we have an online tool called the Livability Index, which is a tool that helps measure how well communities are meeting the needs of people as they age. And you go online, you type in your zip code or your specific address or your city or town, and it comes back with a score of livability for you. And we look at these 7 dimensions of community livability. So housing, neighborhood, transportation, environment, health, engagement, that's civic and social engagement, and opportunity, economic and educational opportunity. And we score your community. We're not saying that your community may be bad if you perceive it to have a low score. What we're saying is that there are opportunities for change to be made, and housing is one of those key aspects of community livability. And so we measure housing in your search location as well. And then here's some other documents that may be useful that AARP provides. There's the Home Fit Guide, quick tips to make your house more accessible or fit your needs as they may change. There's the ABCs of ADUs guide that I mentioned on ADUs, which is really just a first look at what ADUs are and some of their benefits. And making room, housing for a changing America. That's where I got a lot of my data, my demographic data and change, but also just gives you a good overview of housing in the United States and how we need to look at new approaches in order to meet the needs of people as they age. And with that, it's my last slide. It has some of the websites that I mentioned where you can find the resources that I mentioned, and here's how to find me on social media on Twitter. And with that, I will stop sharing my screen.
Thank you, Shannon.
Yeah.
Very, very informative. I was particularly taken by the fact of the multi-generational family housing units, and with the COVID issues that we've had, there's a lot of families that have changed over the last year and a half, 2 years, and it's very important that we all be able to live together and be happy together.
So I think you raise a great point. I mean, I think even before we had the pandemic, with people maybe struggling economically, you know, having moved in, needing to move in with mom and dad, right? Or it's not just a young adult, it could be a middle-aged adult and kids needing to move in with family, and their house may not accommodate them. And so we have to think about housing that could work, that still gives people their separate living spaces, that, you know, gives them some privacy, but brings them together. So, you know, you may find that a person who, you know, has to move in with mom and dad, with a husband and children, they may need to be caregivers for mom and dad, you know, soon. Or, you know, with the example that I gave about grandparents taking care of grandchildren, well, any number of families could have changed because of the negative impacts of COVID. And so, you know, needing to have that close proximity or needing to take care of grandchildren. And so, you know, our communities from a jurisdictional level, you know, opening up or changing or adapting zoning where we could have different types of housing to accommodate that, where we could have programs to build something like a grand families apartment building, I think is really key. But, we need to have both people pushing for it. We need to have communities or, local officials open to it, and we need to have industry saying, hey, this could be something that we could start building.
Mm-hmm.
And I think just the more we talk about it and the more people express their needs, I think we can see it happen.
Very valid point. Here in Madison, we have a extreme housing shortage. We have being a capital as well as having the university here. We've got a lot of housing being built, but having it affordable, having it multi-generational is an issue. And so your points are very valid here. I see that we have no questions from our audience at this point.
There's
Chat box. I'm sorry. Chat box. Oh, okay. To the extent, do you find seniors want to live in high-rise buildings? You've shown a lot of buildings with 3 and 4 stories, but what about high-rise housing?
So that's not a particular question that we've asked. We've asked, what type of housing people are living in now, and then whether or not their house accommodates, their needs. But we haven't asked what you prefer, this type of housing over that type of housing, because we're really trying to get at the needs, of what they want.
Mm-hmm. Okay. We have your slide presentation, and we will make it available to those that are interested. And we do very much appreciate your time today. It's been an excellent presentation, and we thank all of our participants for joining us on our 4th presentation for our Triad virtual conference this year.